Anita Kaliowa struggled to have a child in the first 10 years of her marriage, which almost broke apart because of the pressure. A friend introduced her to a fertility clinic in Kampala, and she convinced her husband to try and have a family through IVF. Up to 9 attempts failed, but she didn't give up. She gave birth to twins on the 10th attempt, but they were born prematurely and died.
When
I was 6 months and 2 weeks pregnant with twins, I developed complications and started bleeding. They tried to stop the bleeding, but it didn't stop, and they had no option but to remove them prematurely. But they only lived for 3 weeks and died.
Anita tried one more time, but lost the baby again after it was born premature. This impacted her mental health, leaving her helpless. Her doctor then advised surrogacy, which she accepted, and now she has one child.
Now things are much easier for people who can't have children the natural way. We used to feel broken because we had no solutions. There are experts who have studied and know what to do. If the tubes are blocked, they can be worked on. If you have problems with your uterus, they can get you a surrogate.
Now one woman is helping women like Anita who have difficulty getting pregnant. Fiona'S went through a similar journey. She had problems in her marriage, and she says she endured mental torture because she was childless. Later, she gave birth to twins through IVF. She then started a foundation to restore hope and confidence among women who struggle to get pregnant by introducing them to fertility clinics in Kampala. Fiona says she's given social and mental support to about 15 couples who now have children through IVF.
When I started this journey, or reaching out to women and just creating awareness about infertility, I have the people that I've met, or the ladies that I deal with, are people who are suicidal, people whose marriages are broken, but they have allowed to stay in that condition because that's what society tells you, you're not worthy.
But many couples can't afford fertility treatment, which goes for about $5,000. Fiona works with fertility clinics to give discounted rates to some disadvantaged women, while many are offered free treatment. In Uganda, about 15% of couples are struggling with infertility issues, and many are too shy to seek treatment.
What causes infertility in women is that usually the commonest cause is tubal factor, when the tubes are blocked or they are not working. That's the commonest in women. It's infertility. Generally speaking, women bear about 50% of the problem of unable to conceive. Men comprise of about 30%. So that's 80%. The 20% is a combination of two. A man has a problem and a woman has a problem.
In the traditional African setting, children are viewed as a pillar of support when parents grow old. Childless couples often suffer a sense of blame and stigma, with the women carrying the biggest burden. Counseling experts say women dealing with infertility need a lot of family support to help deal with childlessness, and health providers have been urged to develop effective interventions to help manage the feelings of emptiness, grief, and depression. Isabel Nakiria, CGTN Kampala, Uganda.